Good morning, everyone. Thank you for joining us for this webinar on the ethical use of novel HIV data and analytics. My name is Charles Holmes, and I lead the Center for Innovation in Global Health at Georgetown and the O'Neill Institute for National and Global Health Law. I want to begin with a quick story. 2 years ago in Southern Africa, a small public health analytics team was trying to answer what seemed like at the time a simple question. Where are people at highest risk of acquiring HIV right now? They had survey data, but it was old and it was over 2 years out of date. And we know that people move around. And so they tried something new. Working with a local telecom company, they analyzed cell tower data to track movement between villages, markets, and towns. And they noticed something fascinating. During major market days, just before the market days, and also just the day after, there was a surge of people traveling from certain rural areas into towns and certain parts of towns and border districts. The very same places where they had also noticed that new HIV infections were quietly rising. Armed with those insights, outreach teams adjusted their approach. They brought mobile testing units and prevention services to those high mobility corridors exactly when people were moving through them. Within months, testing uptake and linkage to care improved dramatically, and exactly the public health outcome that was desired. And obviously, this showed the extraordinary potential of using, quote, more modern approaches to data, as well as analytics and use. But it also exposed, if any of that made you uncomfortable, it also exposed the ethical tensions that we're here to discuss. Because as one community member later asked the team, if you can tell where I go and when, can you also tell who I am? And that question about how to use new forms of data without crossing the line into surveillance or harm sit at the center of today's conversation. And as you know, we're really witnessing a transformation in terms of what's possible. For decades, global health systems relied on slow, retrospective data, national surveys every 5 years, quarterly reports that trickled in months later, and often were not used fully. Now, thanks to big data, advanced analytics, and AI, we can ask and answer questions about risk, about movement, about medication adherence almost in real time in some cases, which is obviously thrilling in terms of the public health potential, but the risks are real and need to be considered. So the Gates Foundation recognized that we're in uncharted territory, a space where the technical frontier is racing ahead in some ways of reflection and ethical reflection. And they asked our team, Maggie Little, who directs Georgetown's Ethics Lab, and me, I direct the Center for Innovation in Global Health at Georgetown, to convene a diverse group to think deeply about these questions. As you'll hear, we brought together HIV program innovators, data scientists, ethicists, and others, and we grounded our discussions in real-world scenarios that I think Maggie will talk a little bit about. So not hypotheticals, but actually emerging realities that force us to not just discuss, but to really confront some of the questions that are emerging. And I think we knew there wouldn't be a single formula for what's ethical in this context. The contexts are actually just too varied, and the technologies are very dynamic. So we designed multiple workshops that Maggie will talk about to really unearth the technical, legal, and ethical and human sides of these quandaries. So the result is a report that we're sharing today that Maggie will talk a little bit more about. So Maggie and our extraordinary panel, who I'm happy to introduce now, will take us more deeply into this work, the process, the insights, and the recommendations that emerge from the collaboration. And let me just kick off by doing quick introductions. So first, Maggie Little is Francis J. McNamara Jr. Chair of Philosophy Director of the Georgetown Ethics Lab. Dr. Aleny Couto is National Deputy Director of Public Health in the Mozambique Ministry of Health. Dr. Lisa Singh is the Sanborn Chair of Interdisciplinary Research and Director of the Massive Data Institute at Georgetown. Ms. Janet Bhila is Country Lead for Zimbabwe Afrocab and the Treatment Access Partnership. And finally, last but certainly not least, is Dr. Nina Hasen, formerly of PEPFAR and PSI, who is Senior Consultant with Achieve Innovations. Before we start our discussions, I want to thank again the Gates Foundation, as well as our government, multilateral and community partners, as well as the whole group that contributed their expertise to this effort. We're focusing on HIV today, but I think as will become apparent, it's really about the future of public health and ensuring that at the end of the day, data aren't just describing people, data are serving people and their public health needs over time. And if we get this right, I think we can continue shaping a new era of innovation, and one that's ethical, one that protects privacy, hopefully advances equity, and strengthens trust over time. So with that, I'll turn things over to you, Maggie, and the panel. Thanks.
Thank you so much, Charles. Let me add my welcome to that Charles just gave. We're so delighted to be able to share the guidance that we worked on with an 18-member working group that was included experts, as Charles said, from programmatic innovators and researchers working on HIV, people from health ministries and communities living with HIV in sub-Saharan Africa, technical experts who have a deep knowledge of novel and big data, and again, machine learning algorithms and AI systems developed from them. And these were technical experts that had a passion for how to use that data and those new methods in a really responsible and ethical way. We had people who were lawyers in public health, as well as ethicists who work closely with computer scientists. So these are people with ethical expertise in the issues drawn with data and AI. We worked for a year together, three-day convenings with lots of collaborative discussion to understand the background, to surface and highlight what the group collectively saw as some of the most urgent ethical challenges that are now and next, and also to identify, and this was a central aim of the project, actionable recommendations, not just the broad principles that are directed toward those who are designing research, those that are imagining and trying to develop the programmatic innovations, to countries who are deciding whether to deploy and agree to proposals, and critically to funders about how they can help ensure and use their resources and power to help ensure more responsible programs in this area. We used case studies, as Charles was indicating. These were illustrative that we spent a lot of time developing after talking to people on the ground who were themselves doing or knew of projects that were happening, deploying new data and AI models in the HIV context. These included an example of doing research on a dating site that was known to be heavily used by people who might be at risk for HIV, such as men having sex with men, getting their permission to find who they were connecting with on the site, connecting that with their permission to HIV status, seeing if machine learning algorithms could find very nuanced data in there to determine what kinds of activities on the site might be indicative of heightened risk of HIV. And if it were validated, to then use the model with ongoing data, anonymized, to identify people at risk and then do specified curated push notifications to them that were aimed to be helpful at encouraging mitigation of risk or access to resources. Gives you just one example. As Charles mentioned, key ethical challenges, as wonderful as these novel data are, they're often gathered from novel contexts, like the use of browsers and apps and social media and the like, mobile phones, right? As Charles mentioned, potentially collecting data on the geolocation of the phones that are pinging whenever they're on. I mentioned anonymization, but the era of big data makes it very easy to de-anonymize data. We'll talk about that more. There are fewer surrounding protections on data in this space. So public health folks can be used to the idea of health data that they collect in traditional ways being highly subject to privacy-preserving regulations, or at least that's the aim. But moving into these new sources of data, from satellites to social media apps and the like, there are very few surrounding protections on those. And as Charles indicated, they often involve commercial partners who would have access to the data, who have their own interests, of course, that may not be consonant with that of public health. In certain countries, there's the potential for civil rights violations. This is about collection and assignment of very sensitive attributes like HIV risk status. And then many of us are familiar with the idea that the algorithms used to generate models might have forms of bias that are difficult to detect, but can be devastating when deployed to determine who gets resources. So with all of that, I want to open the conversation to our panel. And Aleny, I would love to begin with you. So as someone working in the health ministry of a country that's highly affected by HIV/AIDS, can you share your thoughts with us about why the issues that we're discussing here are so important?
Okay. Thank you very much. I think it is important for not just for the ministry, but I think for the whole society, because we as a Ministry of Health, I think we have to embrace the transformative potential of big data and artificial intelligence into the HIV response. I think we have to remember that apart from just have to embrace this big data and AI, we also have to know that innovations cannot be separated by the ethics. And then the advanced technologies that can significantly enhance our ability also to identify risks, improve care, and including saving lives. I think this is important to be salientated. However, these innovations also has to come with important responsibility, and for governments is always important to have some responsibility in whatever that we are beginning with. In this case, when it comes to artificial intelligence, so we have to be responsible in these innovations, which will require safeguarding individuals' dignity, privacy, and also some trust. And at the Ministry of Health, we recognize that big data and AI are double-edged tools. So we have to be very, very careful. They can be powerful assets, but also can have complex challenges. So it's crucial to understand how data can be accurately interpreted and ethically utilized by all, even for the Ministry of Health, communities, and researchers. This also involves addressing some security, some concerns, so it can have protection of sensitive information. As you know, one of the big barriers that we have as a government is that when we have bringing here big data, artificial intelligence, our information will be secure or not. And this is one of the big discussions that we had along the technical working groups when we were developing this document. So we have to think when this is applied thoughtfully, these technologies can facilitate research, can guide us in terms of evidence and evidence-based planning, and can support also communities and ministries in development of effective HIV interventions. Over.
Thank you so much. Nina, if I could turn to you next. You're someone who's worked with programs in many different countries on trying to deliver effective and compassionate care and resources to people most at need with HIV/AIDS. You've worked with programs on the ground, so can you share your thoughts about why it's important to think both about using these technologies and to be cautious in how we use them?
Thanks, Maggie. Sort of analogously to Charles's story about using phone data, starting about 10 years ago, HIV programs really started to focus on contact tracing of people who were testing positive for HIV, to identify sexual partners who might also have HIV and be undiagnosed or unlinked to care. And what became clear to those of us who were looking at this data, across several countries and many communities, was that it represented a possibility that we had been hunting for years, which was, how do we start to really map the sexual networks in which HIV is being transmitted? It's sort of a holy grail of HIV prevention. And at the same time, the use of big data, the opportunity to link data about sexual partners with social media data, phone data, seemed like it offered a huge opportunity to do that. But the ethical implications of that were immediate and glaring to us, partly because HIV is so stigmatized. And so being identified as someone who could be at risk for acquiring HIV in itself made people feel threatened, right? And so I think that is a place where we struggle and still struggle to figure out how do we reach people who are very likely to need testing services? How do we shorten the gap between acquiring HIV and getting connected to services using some of these big data tools without violating people's privacy and without undermining right from the outset people's trust in the system and the healthcare system that they're going to need in order to get the care that they need. And so these issues have felt very alive in the HIV testing and prevention space for some years now, and very important piece of why this convening is so important. Thanks.
My apologies. I'm going to leave that on now. Janet is somebody representing the community of and advocating for the community of people living with HIV/AIDS. Speaking of the contact tracing that Nina just mentioned, I think you had thoughts about what that was like in your own community. Can you share that?
Yeah, thank you, Maggie. So with the work that we've been doing, and as Nina has mentioned, there's a lack of trust in terms of things to do with sharing the data. People living with HIV have always asked, if I share this information, how is it going to work? And why do I say this is because in the facilities or the clinics that people are accessing the services, you're being asked who is your sexual partner. And then with that, you then mention the person who you are staying with or who your sexual partner is, not knowing how that person is going to be approached, or the facility may not know if you have disclosed to this partner or not. And also looking at the diversity of people coming in to this clinic, you'll have people who are sex workers who may have multiple partners. And so this would require a long list of people that they have been having sex with who are potential contacts that need to be tested for HIV. Yes, it's a good practice for making sure that everyone is tested and treated, and also preventing new HIV cases. But also as a result of people not knowing what the data is going to be used for, people then often give the wrong contact details. So that you have the wrong phone number or the wrong home address. So at the end of the day, having to try and follow up this person, you can't find them because they don't really trust if you're going to share this information and keep it in confidentiality, or if there's going to be a breach of trust in terms of have arriving at the home and then having to disclose the status of the person who's already living with HIV. So it's been quite difficult to find new people who are living with HIV that are already existing, and also to trace the contacts that will have been shared within the facility for tracing. Thank you, and over.
Yeah, thank you. Yeah, one of the things that it's important to pull back on then in these traditional applications of data and finding social networks with contact tracing, right? Who else is needs to be helped? We're staying within the community of those who are at risk of or who have HIV/AIDS. When we're talking about expanding into public health programs that use novel data, the collection would be on, in many cases, people who aren't at risk of or have HIV. It's a whole community. I mentioned the example of the dating app. It would be everybody on the app, right, whose data about usage would be gathered. And if it were geolocation data from mobile phones that Charles was mentioning, right, that's all the citizens. And so thinking about that expanded surveillance, the issues that come with the data protection issues, the privacy issues, and other issues really becomes magnified. So that's something to keep in mind as we continue this discussion. Lisa, let me bring you into the conversation. So you're our representative computer science and data scientist on this webinar, and you direct something called the Massive Data Institute, whose mission is, this is at Georgetown, so I have been able to have the privilege of working with Lisa. The mission of your institute is to harness the powers of big data and AI, but to advance the common good, very explicitly. So you have a lot of experience with this, how to try to leverage that power while paying attention from the beginning to the responsibilities and challenges. Can you describe what you see as some of the most important ethical risks in this realm?
So thanks so much for having me here today. I'm excited to participate in this conversation. I think, in listening to everyone before me, I think one thing that's really important for us to keep in mind is context, right? Health as a context is a really private type of context that we have to consider when we're working with any forms of large-scale data. And there's lots of risks, of course, but let me hone in on a couple that I think are particularly relevant for this conversation. So as computer scientists and data scientists who really focus on thinking about methods for understanding different types of patterns that may exist in the world, or finding ways to use data to inform the public in ways that may produce social good, hopefully. We sometimes get so caught up in our methods and our way of thinking about the algorithms in our approaches. We think about correctness, we think about efficiency, we think about accuracy, and we optimize for these criteria. And in the process of doing that, we don't always think about the fact that data represent people, or represent communities, represent individuals within our society. And I think that can cause issues, because that means these algorithms may have certain types of biases. It may be the case that they are not fair to they don't represent everybody within the community. And so that's a risk. Bias of these algorithms associated with these algorithms is a huge ethical risk that I think a lot about. Another thing that I think about, which was alluded to earlier, is that people, when they're using their mobile devices or talking on social media, don't always think about the fact that their data are out in the public, or maybe not public, depending upon the app they're using, but are out in the world and are being used by companies to understand who they are and what their habits might be. And so people tend to give away their data, just take it without realizing its value. And it sometimes is abused. And so I really worry about the awareness of ensuring that people understand how their data can be used and are being used. And then finally, I think I worry about people thinking their data are fully protected, but a lot of new data scientists and new people are coming into the space of AI and don't necessarily know about privacy techniques and anonymization techniques as effectively as they should. And so the risk of de-anonymization, particularly with very unique types of data, health conditions, geolocation, these are unique types of data that can be, if they're monitored, can actually uniquely identify individuals if they're not anonymized or privatized in more abstract ways.
Yeah. Can you say a bit more about the sort of disciplinary culture of computer science and data science? It's a rapidly expanding world, and that's great, right? We do need people probing the possibilities of finding nuanced patterns, right, in data that humans would not be able to find, or to, as Charles said, make use of ongoing streams of data and not just traditional interviews, let's say, to have real-time updates in dashboards of what's happening in the here and now, or the possibility of data troves that one can think of in a variety of aspects, what the telecommunications company has, or for instance, with large language models, the potential for extracting highly personal information that a patient may have shared with their provider in that the provider's notes, right, just written as a natural language. Can we extract that and put it in a database and find patterns of what might give you risk for HIV, but also might be revealing of very sensitive information that could put you in danger if the information got out? That all of those exciting possibilities that really do have the potential to give us more predictive value and help to address the public health concerns, that the data scientists and computer scientists might not be thinking about all of the risks, or about, as you said, sort of how to even think of designing a system that minimizes some of those risks. So can you say a little more about your thoughts about, is that culture starting to change? What can people like you or we can help with to change that culture? What are things that you are hoping for or feel hopeful about?
Yeah, it's a big question. Lots of angles of it. So let me say, I do think that it's really important for us as computer scientists to think about the fact that technology is not developed in a vacuum. We have reached a stage now where technology and society are so intertwined that we can't think about just the isolated methods that we are developing. We need to start contextualizing them more. So that requires some change in curriculum to do contextualization from the outset. And some universities are starting to do that. At Georgetown, we think about ethics in some of our core classes now, and that wasn't the case before. One area where I think a lot of people could start to do this more is thinking about the fact that computer scientists aren't trained to do human subjects research. So because we're not trained to do that type of research, how do we ensure that the background is obtained by computer scientists and data scientists? At our institute, for all of our students that work on projects related to data, particularly with me, they start out doing IRB training and human subject training just so they know that data doesn't equal some abstract idea. It connects to the world and society we live in. So I think that notion of training is very important. But I also think, let's be real, big companies make a lot of money, and they make a lot of money optimizing on what they think humans are going to do. How do we get more click-throughs? That's how they make their money, right? And so, so the cultural shift has to occur outside of academia. We can start it, but this cultural shift has to be from foundations, from society, from people who say, I want my data to be private. I don't want you to use it in a way that you're not supposed to use it. And for people to say, yes, I want the benefits for health, but I want you to protect my data, and I want to know how it's protected, and I want to know who uses it, right? So these are the types of things. We have to empower people to know to ask the right questions, and then we have to train computer scientists and data scientists to think about the ethical questions from the outset and think about the people that are impacted by the technologies that they develop.
Thank you. I want to turn us to thinking about the communities that will be affected by both gathering their data and using the data to put into place health programs, and the importance of getting those communities to have voice, right? And trust in what is happening, or to suggest changes to make the program worthy of trust, right? Aleny, could I start with you, and again, from the perspective of someone at a health ministry, why you think inclusion of the community is so important? What are your thoughts on this?
Yeah, indeed, communities are important because they are not just a merely source of data. For us as a Ministry of Health, they are vital partners, but also we consider them as experts in terms of their own health and well-being. I think the ethical use of data always begins with a joint partnership with communities, where these members are actively participating in shaping how data can be collected, analyzed, and also being employed. I think one of the examples that we can give is when we make community members, when we know that community can be diverse in terms of, sometimes we want adolescents, in terms of culture, in terms of in which area or geographical areas that this person's this community can come, if they're rural or from the cities. I think it's always important to get all this perspective. So for us, it's important to build trust, ensure that their understanding among communities always going to enhance some effectiveness of the programs, and also it will foster and have some shared sense of ownership. In Mozambique, I think we firmly believe that data-driven or artificial intelligence supported HIV initiative, they always has to be incorporated in the community structure. And their involvement for us from the beginning, from the moment that we have doing the inception evaluation, but also is important to engage them during the conceptual phase, involve them as an oversight. They can always give us some insights that we cannot see at the moment. We have to incorporate their feedback during the program assessments also. So recognizing communities for us as a key collaborators, I think also empowers them and gives some of the trust, like you said. We have to ensure that interventions are culturally appropriate and ethically sound. So them as collaborators is very key. For us, the partnership can act also as an external eye, can provide us critical insights, can flag for us some issues, ethical issues, and also we think that they can help safeguard against potential risks that can come along with the introduction of innovations. For us, is meaningful that community engagement can lead us to more sustainable, equitable, and I think very impactful HIV response. So involving communities from the outset for us is vital for fostering transparency, some trust in the main, and also, inclusiveness. Can provide us valuable insights into cultural sensitivities, helps identify potential ethical dilemmas before they can escalate. For us, the goal is not to hinder innovation, but to promote responsible progress in terms of respect of human rights and civil society values. So ethical considerations that must be integrated in development process and to help to prevent misuse, reduce the risk of harm, and ensure that technology advance serve as a common good. Thank you. Over.
I want to pick up on something you said, Aleny, about the stages at which community involvement is so important. And I'm so glad that you mentioned the idea of it being of community involvement in the very conception of the idea, right? And in the case of the potential, of using data from a community for a purpose, the community is going to have a better understanding of what data matters to them and what the on-the-ground risks might be to them and their family and their communities of if that data were to get out, and how much they think the proposed benefit of a program would be relative to those risks, and help getting them involved early to help them not only raise those concerns, but maybe have their own ideas about what can mitigate or what would be a better idea. So I wonder if you wanted to say anything more about that, how you all think about getting them involved at that very early stage, that kind of public consultation about possibilities, if you have thoughts on that.
Yeah, I think is always important, not just for the community. I think even for the providers, is always important to involve them when it comes to talk about the draw of any policy in anything. For me, I think the community are always key. They are very essential on that. So all these phases in a moment that we have an idea, we are saying that we're going to introduce the artificial intelligence, and we're going to use the data. I think Lisa talk about some points and some of the concerns. So if they do have concerns in terms of data, in terms of artificial intelligence, is the moment that we can really solve all these concerns and solve all the problems, all the things, all the misunderstanding that we might have. So the involvement, I think that will have some more take, and they'll collaborate more when it comes to introduce these innovations. Over.
Nina, I see your hand is up. Please go ahead.
Thanks, Maggie. I think another issue that often arises is that these big machine learning tools and artificial intelligence can be a hammer in search of a nail in the HIV response. And so donors can be thinking like, are we missing some opportunity here to use these big sophisticated tools? They're kind of often putting out calls for proposals that are related to these tools, and they can be really great. But we always need to be starting with the problem that we're trying to solve and working from there. And the community, all levels of the community, including the system of delivery, the healthcare system itself, needs to be engaged in identifying and agreeing on the nature of the problem. And once you do that, figuring out how to use the tools best follows much more logically. So, thinking about the donor community, just that foundational design principle of starting with the problem and not with a possible solution, I think is helpful in avoiding many of the pitfalls that that Lisa and others are citing. Thanks.
Really helpful. Janet, again, as somebody who advocates directly for the for people living with HIV/AIDS, you've had experience on the ground of how a lack of community engagement can have real downstream effects on the trust of a community to use the programmatic innovation, the products, etc. I wonder if you could give us a couple of examples from that, from your experience. It doesn't have to be about the data issue as much, just reminding us, refreshing, and making vivid to all of us the way in which deep community and continued community involvement is really important, and as important as the technical details to getting success. I'll turn it over to you.
Thank you, Maggie. I think an example that's coming to mind is when we're talking about the optimal treatment for people living with HIV. When we were transitioning from efavirenz to dolutegravir, that dolutegravir was good for the efficacy of reducing viral load in people living with HIV. So in the initial stages, when it was then distributed to people and they started using it, the data that then came out, or the information that people then got, was that it was harmful to women of reproductive age and women who are pregnant. So that then gave a lot of people fear, and they were skeptical to then take dolutegravir, because then the issue was, if it's harmful to women of reproductive health, then what about those that are already out of reproductive health? It could be a challenge. So with the help of advocates and people who were passionate about people living with HIV and their optimal treatment, the information was then shared to people living with HIV, and we had to then sit down and understand the data, and that's when we got to understand that it was a small incident that happened at some point, and it was then cleared that women of reproductive age could be able to then take dolutegravir, and that it's safe for everyone to take. So with that, I think it was mentioned by the speakers earlier, to say, if you don't share information with the community, the people who are going to be the end product users, and then that information then comes out in another way, it would be difficult for people to accept that product. And also, if you don't work with them or communicate with them at the beginning and in inception, it would be difficult for people to then accept it, as long as they don't have the proper information. The other thing that we've also noted in working with all stakeholders and donors is, because we are, being the community, most of us are not scientists or doctors. So at the end of the day, it's difficult for someone, a layman like me, to understand what a computer scientist would do. But if it's laid down in layman's words or in layman's information, I can be able to understand what we're going through, and I can be able to contribute to what the community can be able to access, and what they'll accept and what they will not accept. And
Let me, if I
also
can,
the activities they would be able to. Yeah, sure.
yeah.
Go ahead, Maggie.
Yeah, thank you for that example. I know the dolutegravir experience was incredibly distressful and harmful to the researchers, to the community. It was a real moment of pain, I know, for all. So I'm glad you brought that back. And I want to highlight something you said about the advocates, right, like you, learning the technical details about that signal of that turned out to be, thankfully, not confirmed. Got the technical information and then were able to explain it in ways accessible to their community members. That in this case, as you said, training is going to be needed. And one of the recommendations that the working group that you all were members of really talked about that point, that there needs to be capacity building of community advocates to be able to understand technical details, but enough technical details, right? There's a point at which we don't need to get into the weeds, but there are issues that are really important. What the proposal will do and won't do. I mean, to give one example that the working group really emphasized, the difference between a proposal to, for instance, track how often somebody accesses an app versus knowing the content of what they say, like the content of their phone call, let's say. These are common confusions. You know, all of us who aren't computer scientists and data scientists often have those confusions. And at the same time, understanding actual risks. Like Lisa, you were mentioning, people just really often don't know how much of their data is collected and what risks might be associated with it. So, Janet, this is just to say I'm very glad that you underscored the role of community advocates. They're so often a very needed part of disseminating in usable forms the key information to the community. And to do that well, the advocates themselves need resources for training, which is something that funders and the like should think about. Let me turn to you, Nina. You've talked about the importance of community involvement a great deal. I know it's an issue you're passionate about. One thing that I think is emerging already from this conversation is that there are many reasons that community involvement is critical, right? We should sort of disaggregate a bit. One is what Janet highlighted, that if people don't understand, then the effectiveness of the program itself may be imperiled, right? If you get mistrust, that isn't earned, I mean, that isn't warranted by the actual facts. A separate one is, you know, I guess I was mentioning, the community will have knowledge that others don't have, and knowledge that really matters. What are the on-the-ground conditions, the on-the-ground risks, what people actually care about that wouldn't be known if you don't have them in conversation. And I mean, others that I know you've spoken about are really about community agency. If it's their data and the resources that their country has that are being decided by this, then even if you could know everything about the risks that are relevant, they should still have a say in what decisions are made. So can I ask you to speak to that last issue, especially, though any comments you want to make on community involvement are welcome as well.
I just, I'm very conscious of two enormous trends or changes that have happened in the landscape since we first started working on this. And one we were in the midst of, which is the impact of COVID-19 on people globally, on people's perceptions of public health and the healthcare system and trust in what they read online. And one of the things I've been reflecting on is the importance of building community education and community knowledge about big data and machine learning and AI without necessarily tethering that directly to HIV or even to public health, to try to build a more educated populace, and that, you know, and to be educated by that populace in the way that we do this work, or else I think we're just not going to penetrate, right? The other thing is the awareness that the funding situation and even just the context, the political context at work in health is changing so much, and understanding that people like Dr. Aleny are working in a radically different funding scenario than they were when we started doing this work. And that is going to drive, and Charles has mentioned this too, that's going to drive a big demand for interventions that can replace humans with machine learning tools and other artificial intelligence tools, and that may be required in order for us to maintain like a minimum of services, right? And so being realistic about that and understanding that, and trying to, again, like to the extent that we can, and I just want to also acknowledge that engaging the public, engaging the community costs money. It's not free, right? And to try to balance that to the extent that we can and be realistic about it, right? This is a not letting the perfect be the enemy of the good moment, if there ever was one. But at least to stay alive to that, the awareness, we're taking some risks here in order to try to keep as many services available for people as we can. And to balance that and be cognizant of it, even if we can't do it exactly the way that we want to. So that would be the points I think would be most important to me.
Yeah, well said. It's a tough situation right now. Well, with all of that in mind, I see Lisa's hand is up. Go ahead, Lisa, please.
It's such an important context to think about right now, right? We want communities to be involved from the outset, but in certain contexts, would they even come to be involved if you didn't have certain, maybe you were paying them or some incentive to be involved because they may not want to be associated with a group or a position. There are other impacts in society for them to be involved. So one, how do we do this in a smart way? I don't think technologists know the answer to that. So that's something that I think those in the social sciences and those on the ground who work with different communities really have to connect technologists to, because they wouldn't know that. But two, I want to come back to this point about training. Like, we live in a world where technology is just everywhere, right? And if we look back, I like history. It's one of those things that helps me contextualize where I am. But if we look back and we think about cars, right? We don't let people just drive cars without some form of training. In fact, most places even require a license before you can drive a car, right? But we'll give you a phone and a smart device without telling you how to do it, without telling you where your data is going, what's happening, without you having any literacy as to how it works. As to how it works, because we want you to use the functionality to improve your life in certain ways, right? And so what does that mean? What does that mean as we think about these technologies for harm and good? How can we ensure that we are enabling people to understand them to a level? Look, I don't know how to do certain things with an engine in my car, but I don't need to, right? I just need to know certain pieces of information in order to drive my car. So can we synthesize a set of information for the common good that people just need to know about the different devices they use, about the different apps they use? And maybe we should have governments or regulation that says you need to share this so that people are aware of how the chatbot is using your query that you asked it, or how an app maps, gets your consent right at the beginning when you say you accept everything, so they can track you and track all your friends or whatever it may be that they're doing, right? So this is a moment, it's a real inflection point where we might have an opportunity, where people are outraged enough that we might have an opportunity to instill some of this. So thinking about that from a community perspective, I think is really important right now.
Yeah, I'm getting a picture in my head of the sort of nested circles of where change needs to happen. And nobody can do all the change at once, but making progress in each is going to be helpful. So one is at that broad social level of social knowledge, right? People's baseline understanding of, as you say, Lisa, not how the engine works. Nobody needs to understand the code, but to understand things like what data is being collected, who has it, what can they use it for? For instance, the huge economy in selling data that isn't highly regulated at all. So that's one thing. And then when we get into the circle of the health context, right? For people who work in public health, this is a very new context, or for clinicians, very new context that isn't new risks and understanding of potential that's different from like the risks and benefits of a drug, right? Or of a public health educational information program on the need to vaccine. And then when we get to the inner circle of HIV/AIDS or other diseases that have especially strong incidence in low resource settings, where you've got those further constraints, and where so much of the data that's relevant and the attributes you assign, right? You find the pattern of what would predict HIV risk, let's say, but then you take that HIV risk and you have to attach it to people's records, right? So that the data we're talking about is incredibly sensitive data. So having to have contextual awareness of all of that, even if we can't, to return to the immediate, researchers and communities and program innovators in HIV/AIDS can't solve the big context, right? But it is important to know about all that context to be able to recognize that what is being thought of exists in a situation where people don't have that awareness. Public health and clinical health is not set up to protect here. Before as they start to even think about what data to collect or what they would imagine an ongoing program of collection and use would look like.
One thing, Maggie, I might say that kind of crosses your circles, all of them, like through a different direction, is that this is your data. So consent. What do you, where I need to consent for you using every piece of my data that I'm not just broadly publicly sharing with the world. That notion crosses all those circles that you have, and I think is really important to help flip the idea that, oh, companies are giving you these services so they can just have your data and do whatever they want with it, to wait, this is me. This is just like my blood or my whatever. This is a part of my identity, and I should control this part of my identity.
Yeah. So that actually connects, and Nina, I might go back to you on this. This issue of consent, which is incredibly important and challenging, right? The working group talked about this. Because again, it's not just saying, here's where your data goes, right? But what use can it be put to, right? It's not just this data, but if it's combined with another database and then used and then later sold, there are these sort of sequelae that can happen. But so finding a way to have some knowledge and consent and control, right, of your data. But then there's another piece that, especially in public health, we legitimately don't always ask for every individual's consent. That's sort of, public health is in a very different context, right? We're going to do things at a population level. We can't ask every individual. But we're supposed to do is to have mechanisms of legitimacy, right, of deciding. And that includes things like the government should be transparent if it decides to collect this sort of data, and how is it going to be used, and also, this is where, Nina, I'd love your thoughts. That's why it's important for the community to have understanding and agency to participate in that national conversation and the government action. So can you speak to some of the challenges that might involve, or why you think it's so important for communities to have say in what policies are decided?
I feel like this is a conversation also with Aleny so much, right? Because you know, it's just, it's very, first of all, I want to say it's a very like kind of Western and even United States notion, this idea of individual consent for everything, right? In many countries, governments make decisions, right? And we often perceive that in the United States as being very controlling, but in other places that's considered to be like, you know, it's the job of my government to take care of me and make decisions about, for example, how data can be used. And especially in situations where the idea of being able to have like even a 5 or 10 minute conversation with someone about consent is just not realistic. I think it's really important that governments are making these decisions, right? And that governments, like, you know, as Aleny is saying, you know, the governments aren't making these decisions in a vacuum. They're the convener of the communities to make these decisions, and they get made at the community and government level through consultation instead of at the individual level. I think that's really important, because the ability of individuals to fully understand and contextualize what's going on in the middle of, say, an interaction with an outreach worker on the street, just it's not realistic. And we see over and over again, you know, all these like user agreements that we have to sign every time we download a new app, or, you know, buy some new piece of equipment, and we're like, yeah, agree. Because what you want to do is get to the point where you can use the thing or do the thing, right? And so we need to not burden, we need to be realistic about what we can accomplish at the level of individual consent, I guess would be my point. I'm handing over to Aleny here for her input.
See your hand, please, Aleny.
I totally agree. When you have responsibilities, and sometimes there are decisions that you have to take because you have someone in front of you. So I'll give an example when it comes to testing for pregnant women. The other day we were discussing with the parliamentaries, and they had the perception that what we are doing in terms of testing of pregnant women is something that they are being forced. And we said that it's not that way. You can give some information. We can do some opt-outs sometimes. And then give all the information and tell them that why is important. And then when it comes to individual, just take the decision that if it's important to do or not. And we are not talking about, I gave an example of a pregnant woman where sometimes she is in a vulnerable situation and she has to take decisions very fast. So why not to make opt-out something that really can lead us to have some consent somehow, it has a fast way to do and take some of decisions. Consent, okay. Is something that also we see a lot of civil society, mainly when it comes to, for example, when it comes to those ones on loss of follow-up. We want to see where we want to find out why they are not coming. And when we go after, they go like, why you're coming? I didn't tell you to come. But it's someone that is not undetectable, is someone that's still not using condom, is someone that's still, all these things, you know, I think is very difficult. And when it comes to consent, is something that we have to, is a double-edged thing, but decisions, it has to be made. And all the best is that give all the information that's necessary and take decisions to become very fast over.
Thank you, Lisa.
So I actually really agree. When it comes to technology, if we had individuals make decisions on every piece of consent, they wouldn't necessarily understand things well enough to know whether they should consent to it or not. So one mechanism that has emerged in the computer science arena that I don't think has taken hold outside of computer science, but I think we should think about as we're thinking about different mechanisms, is this idea of like trusted groups. Like, so I, as an old person who cares about my privacy, may want nobody to ever get pieces of my data because that's who I am. But my daughter, as someone who loves social media and understands privacy, may be willing to give more of her data for certain types of things. So there's this notion of people who are like you, but who could group together so they could together decide on whether or not how the data is going to be used is aligned with their values and what they believe is reasonable for data. Different areas of public health, different areas of socialization. And so I think we need to think about these. We need to think out of the box about different mechanisms to help the public who may not know as much, and think about this at a community level and a society level, as Nina was alluding to earlier, right? It doesn't have to be an individual level decision as much as it has to be the norm for the community that you're comfortable with. Like, what gives the community comfort? And is there someone who understands the technology who can inform this community so that they can decide what line of comfort they have?
I love, Lisa, that you returned it to that concept of community, which is so critical here. So of course, there's the individual, very, very important. Do you want to opt out? What options for individual control are there? There's the government social level of you do have to do policies at times, but you want some input. But then there's also the idea of having community and community groups and community advocates, which in the HIV/AIDS space is a particularly well endorsed principle with lots of infrastructure behind it. Janet, I'm looking at you with the work you do with Afrocab, et cetera. So thinking about ways for communities that represent people living with HIV/AIDS and communities that represent interests of the broader citizens who will be affected, and having, we could imagine some convenings, conversations, trainings with and that some either recommendations could come from those, or at least outlining what they see as the most salient and important issues for the government to consider on behalf of their communities. Well, I like that we've started talking about how we move forward here and ideas for concrete things that can help. As I mentioned at the very start of this webinar, a key aim of the working group was to not only surface some of the key ethical challenges and risks, because again, at granular levels, like how well are telecommunications regulated on the data that they collect. So we got very, very granular. What are the realities of how research proposals are developed and the exigencies they face? That was mentioned here. How do funders work in this space? So not only surfacing those, but then together thinking about some actionable recommendations for for different sort of actors. And you all in the audience will see that there's a link both to the full guidance and to an executive summary, but also specific summaries aimed at researchers and programmatic innovators, right, as they design and think and implement. And again, recommendations specific to funders and other multinational organizations. So encourage you to take a look at those. But we can share and talk about a few of the ideas. And as we begin that conversation, let me encourage you in the audience to submit questions that you would like to see if we can address. Are there experiences you all have had or that you've heard about in this space that you would like to for us to know about, or questions about, or things you have heard about what's afoot with these kind of developments, and what you'd like to ask the panel? So let's talk about moving forward. And Aleny, can I have you start? One of the central recommendations of the working group was to add ethics into formal review of research proposals, right? That the IRB should look not just or ethics review committee should look not just at the technical and all of that and the logistics and the benefits, but an ethical risk assessment, as you will. Or again, for programs that are suggested, formal ethics reviews to join the infrastructure of assessment before decisions about deployment are made. So Aleny, could you speak to your view about the importance of this and how funders, right, might help the situation, since they have, of course, highly constrained right now. But as we think about what's critical to prioritize and as things move forward and hopefully become better, can you speak to what could help governments like yours to add ethics into your assessment of programs?
Yeah, as I mentioned previously, concerns, and we discussed a lot, and then we saw Lisa bringing the differences of in terms of security and misuse of data. But we believe, but once again, I want to reemphasize that technologies also hold immense promise, and it is important that we have to really look in terms of ethical integrity in everything that when it comes to these new programs. For us, it's crucial to that ethics can serve as a fundamental pillar. For us, it guarantees a greater accountability. I think is important, and that we have to do along with donors. All this ethical consideration and remember that cannot act as a barrier to the innovation, but it has to act as a framework that ensures responsibility and development and deployment. So donors, what donors can do and what we can recommend to them is that they as an applicant and someone that's coming to give a technical assistance, ethical assessments must be one of the things that they have to really discuss with governments, and this has to happen at the moment that we do at application stage, when we are writing for COP, when we are writing for Global Fund. Those are the big applications, or any application that donor comes with. I think showing in those applications that data has to be protected, that consent must be managed, and how communities can be engaged in terms to design of these applications. This is not being done to slow innovation, but I think it's to ensure that we have accountability and also we have some respect. So we have to strengthen all this process by reviewing, approving these innovations, but reflection on ethical should not be limited to a traditional research, but also has to be embedded in continuous elements of the entire life cycle, even when we are introducing big data and artificial intelligence. Over.
Yeah, I appreciate that so much. Thank you, Aleny. So in these calls for proposals or offering of programs, it's well understood that there needs to be assessment on a variety of areas, and that you get technical advisors who are experts in that area, so that the expertise needed to do a genuine assessment is available. And so thinking ahead of time about how to include people who are experts in data and AI ethics and public health data considerations as part of the review team, we had decided would make an outsized difference in shifting the needle on this issue. And let me just, sorry, when I talked about asking questions, please use the Q&A function. That's what we've turned on for the audience to submit. So yeah, identifying it ahead of time and identifying experts who would join the review panel, very important. Nina.
at the risk of being repetitive, I want to emphasize again that, starting with really clear identification with with providers and the community, what is the problem we're trying to solve, right? We can avoid a host of problems by starting there when everybody is aligned.
You went on mute for a sec, Nina.
Sorry about that. Click the wrong button. When you have good alignment, right? We have too many people who are starting treatment and not staying on treatment. And we get everybody together and we figure out what's the problem there. And then we go to, is there an opportunity for a new technology to help us solve this problem that we haven't been able to solve with the people that we have available to us, with the tools we have available to us? That's when we bring in the experts and we start to engage in that, right? And that's when you already have a group of people who are affected, who are thinking about it together. I think that to me, that's really a message also to the donor community around,
Yes.
right, how do we organize this in order to, right from the outset, have the kind of inputs that will help us stay out of trouble and in the right path. And also just to acknowledge, what Aleny said, like ethics are really important. They can't be a barrier to innovation and moving forward. And that means we also are going to make mistakes. And so figuring out how to start stuff at a scale where we can detect mistakes early and address them is important. Being able to move forward in a stepwise way. And we always do that anyway. We can't usually go from 0 to scaling overnight. But to emphasize like this perfect versus the perfect being the enemy of the good problem is important. Thanks.
Lisa.
Yeah, so thinking about kind of grant funding and how one can connect. So I'm always brought back to what Nina says, oh, start with the problem, but I want to advocate for not only starting with the problem, but starting with the problem with a technologist who cares about the problem or who's interested in the problem. Because I think a lot of times you might come up with solutions not even knowing what the technologies are that are out there. And so this idea that technological innovation can also allow us for reconceptualizing problems is possible, right? Like, and you might shift the problem a little bit just because of certain types of innovations that you didn't think about before. If you don't have a car, that brings up a lot of different things than if you do, right? So I think this idea of these cross-disciplinary individuals and these cross-community individuals. So someone from the government, someone from the local community, someone who's a researcher, someone who's a technologist, someone who's an ethicist, all these people coming together at the very outset is really great. And to your notion about proposals, so intellectual merit is an NSF requirement, broader impact, data sharing agreements, facilities management agreements, just general management. No reason we can't have ethical assessment. I think that is an important recommendation, and I think it's one that is easy for funders to add in.
Thank you. We have a question from the audience. Thank you for the presentation. How do you balance idealism with realism? How do we begin to start to try to add these programs into unregulated industries surrounding big data? What will actually work short of congressional action? So we know we're not going to wait for congressional action in various countries, right, for various different reasons. So it's a great question, and thank you for it. And it's very much one that the working group put front and center, right? So taking as a fact the challenges that HIV is still highly stigmatized in many countries, so that data is sensitive, that the telecommunications company do face some regulations, but how much do they face? That people don't always know much about their data. So what do we do in light of those realities? And given the importance of pursuing these projects, Nina, you had said at one point, I remember in the working group, it can be unethical to gather the data and do this. It can also be unethical not to, right? If they present a possibility of strongly advancing public health, we need to. And there are many cases where it would be incredibly beneficial. So if we can talk for a few minutes about some of the concrete ideas that the working group came up with. And Lisa, I know you were just speaking, but let me ask you first, as one of our technical advisors, you shared and we incorporated some ideas about data protection, or what data you gather, what to think about with that, and also how to address and mitigate some of the issues around algorithmic bias.
Yeah, absolutely. So I think one thing that we can just do as a starter is when we're thinking about addressing issues in public health and solving different, or trying to tackle different problems in public health, we can think about how much data we actually need. And what do I mean by that? Well, maybe I don't need the details of every person's health criteria. Maybe I only need one field, or maybe I don't even need it at the individual level. Maybe I only need it at the neighborhood level. And so understanding the level of detail that's necessary and only capturing the level you need is just an ethical thing to do, right? Like, it's something that we can do responsibly, and then we don't have to worry as much about some of the privacy mechanisms if we're doing aggregated data to start with. The privacy burden is lower for us. So that's one area where I think that's important. Another area is if you are in the space of developing AI models and you are in the space of machine learning, pause for a moment and look at your training data. Is it representative of the populations that you're trying to build a model for? And if it's not, there's a lot of new techniques that exist that allow you to improve the fairness and reduce the bias of these models. So do it. Take that extra effort, takes the extra time to either collect more training data or use some of these new mechanisms that already exist. And then, when possible, use an interpretable model so you know what features are being utilized to make decisions in case it's a feature that shouldn't be utilized to make a decision.
And Lisa, can I interject and ask you to just briefly explain what you mean by an interpretable model?
Thank you for making me answer that question. I sometimes get so excited about my computer science that I forget. Okay, so so we can imagine that you have a set of data, and you have these different features in this variables in this data. And what you're trying to do is you're trying to understand which variables, like demographic variables or mobility variables, where people are at a particular time, which variables are the ones that are the best predictors for what you're trying to predict, whatever that may be, whether it's HIV or some other health condition. And so, so a model is what we build using these data, and we use this model and we on data that we've never seen before to make a prediction. And so one thing about these models is sometimes some types of models we build, we can see exactly which variables were utilized in the decision-making process. And for other models, because of how they're designed, they don't keep this information in a way that is coherent enough for us to interpret or understand right now. And those are viewed as uninterpretable models, meaning that we just can't totally figure out how the decisions are being made. So if you're using an interpretable model where you can see how decisions are being made, that's beneficial, because in the health context, you really want to understand how decisions are being made. However, we've found, particularly with generative AI and other areas that are emerging in the AI modeling context, that some of these uninterpretable models are quite strong, significantly better than some of the interpretable models for certain classification problems. So if that's the case, where there is this huge discrepancy, you have to pause and think first, should I be using this model or not, given whatever the question is? But second, if I am going to be using this model, how can I audit it in so many different ways to ensure that it's being fair, it doesn't have certain biases, it's not inequitable in certain ways? And that becomes part of your process of designing models and tools for public use, for public health use. Hopefully I answered your question, Maggie. And
You
if
did.
I confused you more, tell me.
No, that's fantastic. So I know we're nearing the end of our time together. Let me mention again, you all have the link to the audience. Sorry, you have the link to the guidance, and again, executive summary and a summary specific to researchers and program innovators and specific to funders and multinational organizations. One way to think of the answer to how do we even begin to start doing this, right? Thinking in terms of categories, and there are details contained in the guidances to fill these all in. So one category is what Lisa was just addressing. There are technical things you can do from the side of computer science and data science issues to make sure that those experts in your team or in the government are thinking about these issues. There are, as Lisa knows, she mentioned audits. There are specific audits that can be performed on AI models that you can have somebody come in and take a look at, right? There are certain kinds of data protection ideas that are detailed in the guidances that are actionable now. There's also a category of that's broader, but designing with ethics in mind from the beginning. So thinking at the very outset, and for this you might want to identify ahead of time a data AI ethics person. And there are increasing numbers of these. And you can, we give some ideas about how to find somebody like that, but to consult with them from the very beginning about the ideas that you have. To add review of the ethical issues, have they worked to mitigate ethical risks, right? Gather the least information needed, the least sensitive information needed, keep it for as little time as possible, all these sorts of things. And then finally, and really critically, involving communities, and the guidance outlines a few models that people can take, and asking also funders as they can to support the efforts of ethics reviews by helping with some trainings of core teams that a country can use. So our time is coming to an end. I want to thank all of our panelists for their passionate commitment to this issue and for participating in this important conversation. And to members of the audience, thank you for listening. And again, the link to the guidance is posted. Thank you, one and all.
Thanks,
Thank
Maggie.
you.
Thanks, everyone.
Thank you.
Thank you. Bye.